Hi, this is Dr. Kathy. I just want to talk through with you today about how I recommend doing a trial of Vyvanse for someone who's already diagnosed with ADHD and already been on short-acting medication or longer-lasting methylphenidate. And the reason I'm talking this through is it's a little bit faster than the way I would do a trial with people who are new to stimulants. So basically, Vyvanse is lisdexamphetamine dimesylate. Lisdexamphetamine dimesylate gets absorbed and the liver metabolizes it and then releases the active ingredient. It chops off the list bit. And so you need to know that because the dose is based on how each person's liver handles it. I've had a pharmacist criticize me that a child has been on 70 milligrams because it's too much for a child. In fact, the flip side is the reality. Children have faster metabolism than people do as we get older. Certainly at 60, I can tell you metabolism slows. And so because metabolism slows as we get older, we expect a child to metabolize much more quickly. And so it would surprise me if someone of my age was on 70 milligrams. Anyway, what you need to know is that it takes about 45 minutes for that metabolism to start to happen. So we don't see anything for the first 45 minutes, and then we hit maximum level at 1 hour. It comes in Australia in 20s, 30s, 40s, 50s, 60s, and 70s. There are 10 milligram capsules overseas, but we don't have that. When I do a trial, I'll give you a script for 20s and 30s. Now, the principles are that the maximum we're allowed in Australia that is subsidised by the PBS is 70 milligrams. We need to do 7 days at each level, and we jump by 20 milligrams if there's no benefit, tweak up and down by 10 milligrams if we need to. So I recommend starting at 30 milligrams, even though 20 is the lowest. There will be a small percentage where the person may be a little bit flat on this, and we can go down to 20 milligrams straight away if the child is too flat. However, after 7 days on 30 milligrams, if you need to tweak up by 10 milligrams to 40 milligrams, that's going to be 220s. If you find that 30 milligrams has done nothing for the first 7 days, then you're going to want to go to 50 milligrams, which is 120 and 130, funnily enough. Excuse the sarcasm. So after 7 days of, let's say, 50 milligrams, if you find that it's slightly too much, you can go down to 40 milligrams, which will be 220s. And if you need to go up to 60 milligrams, that will be 230s. So again, after 7 days of, let's say, 50 milligrams, if it's doing nothing, you can jump straight to 70 milligrams if you need to, which will be 220s and a 30. And so within 15, 16 days, we tend to be on the right amount. It might take a little bit longer to be sure. It is possible to change during the school holidays of a term break. It can be a little bit tight. Obviously, we're trying to improve the hyperactivity, impulsivity, and concentration. Too much will make a child too flat, cut the dose back. Now, if you really get way too much, we can get rage, but I'm hopeful that people will cut the dose back and not allow the child to get too flat. And by flat, I mean lose their spark. It does reduce eating, and we've got to keep an eye on the appetite. It can provoke the motor tics. It can make people emotional. Rare nausea, diarrhea, tummy pains like gastro, stop it. Is the child unwell or is everybody unwell? If you're not sure, once they're well again, you can retry it. If you think it's the child, then let me know and we can try something else. I've had a couple of brief heart palpitations. I've had dry mouth, and I had it's quite a rare problem of reduced blood supply that can cause muscle cramping, especially to the legs. Now, If you find that your child ends up on 40 milligrams or more, you're going to end up using too many scripts. And on page 2, I've got a letter to the pharmacist just in the short term to release medication early, and they're not allowed to do it without this. And then let's say you're finding 40 milligrams is awesome. Then I've got a suggested email to let me know so that you can ask for me to change the script. And the idea of putting this there is so that you know what to write. Some people are a little bit worried about what to write in that email. So hopefully this is helpful. Let me know how you go if there's problems.